Welcome, and thank you for joining us today. I'm Bob Continetti, Senior Associate Vice Chancellor for Academic Affairs, and I'll be your moderator for the town hall. Today, we're bringing together a group of panelists to provide some updates on our operations during the COVID-19 pandemic and to answer your questions. Some questions were submitted during registration, but please feel free to use the Q&A window to submit additional questions for our panelists. Due to the time limitations today, we won't be able to get to all of your questions, but we will log the questions as they come in and post the answers on the Return to Learn website. And that link to that will be inserted into the chat. Today's webinar has closed captioning available in two ways. First, you can click on the closed caption button at the bottom of your screen and select Show Subtitles, or you can also click on the link that is going to be pasted into the chat. For now, though, I'd like to go ahead and introduce our Chancellor, Pradeep Khosla, for some welcoming remarks. Chancellor Khosla.
Thank you, Bob. Good afternoon and welcome everybody. When we expanded our multi-layered Return to Learn program this fall, we had reason to believe that we would be successful. And I'm happy to say that our success has so far not only has become true, but it has far surpassed our planning assumptions. Throughout the fall quarter, our faculty, served as a role model for your students and your colleagues. You encouraged and reinforced behaviors that help keep our campus community safe. As a result, our campus has one of the lowest numbers of COVID-19 cases in the country. Since March 1, we have conducted nearly 80,000 student tests and nearly 20,000 campus employee tests. We have expanded our wastewater testing from 6 to 52 sampling sites and are adding more for a total of about 200 across campus by next quarter. We have increased support to you and our students for remote learning. We have constructed outdoor classrooms with a full complement of technology aids for in-person and hybrid education. We have closely followed guidelines for masking, physical distancing, and sanitation. And we have consistently screened, tested, and sequestered and isolated when necessary. The data are in and show that students are safer living on this campus than in the greater community. Our Return to Learn approach, I believe, is working. From October 1 to December 7th, the 14-day positivity rate for UC San Diego students on and off campus averaged between 0.12% and 0.68% respectively. On campus was 0.12 and off campus was 0.68. And during that same time, the same positivity rate for San Diego County has averaged between 2.7 and 7.4%. Consistent participation across all of our Return to Learn strategies throughout the fall quarter has made our campus significantly safer than San Diego County. From the beginning, you, our faculty, embrace the responsibility of showing students how Tritons protect Tritons. You have worked tirelessly to deliver a consistent educational experience that reflects our high academic standards, whether students are in person or in virtual classrooms. And here at the end of the fall quarter, I can look at each and every one of you and say, thank you, thank you, thank you. Thank you for rising to the challenge and making us who we are. Our work has paid off, your work has paid off, but our work is not done. We cannot let our guard down. And it's more important than ever that we continue to wear masks, wash hands, and avoid unmasked gatherings. Please complete your daily screenings and regular testing. None of this could have worked without your support and your commitment. And needless to say that you're integral to UC San Diego's continued distinction, prestige, and success. So thank you, thank you, thank you one more time. And let me just say, I hope you enjoy your upcoming break. You've earned it. And I look forward to seeing you in the new year. Back to you, Bob, sir.
Thank you for those important reminders, Chancellor Khosla. And now I would like to welcome the host of today's town hall, UC San Diego Executive Vice Chancellor, Elizabeth Simmons.
Thanks very much, Bob. It's a pleasure to join you in welcoming everybody to today's session as we discuss the latest developments related to campus operations, including planning for fall quarter and promoting the health and safety of our campus community. One topic that is probably on people's minds is okay, the host muted me, but I'm speaking, so I'm unmuting myself. Given the current stay-at-home order and the fact that we'll probably when we come out of the stay-at-home order and We'll probably be in the purple tier again for a few weeks, where we're not allowed to do in-person teaching indoors. It's almost certain that we'll need to start the first couple weeks of fall quarter with our in-person teaching being done only outdoors, just as we are in that state right now. So AVC Carlos Jensen will be able to fill you in on the latest plans and options, and our goal will be to support all of your creative teaching and learning ideas. So we've received many questions from faculty, and the panelists and I look forward to addressing as many of them as possible this afternoon. I also, of course, encourage you to keep visiting the Return to Learn website, returntolearn.ucsd.edu, for answers to other frequently asked questions and the latest campus updates. And now I'd like to turn to our Academic Senate Chair, Stephen Constable, to say a few words before we get started.
Thank you, Elizabeth. We're almost at the end of the fall quarter, and I'm sure you're all looking forward to the holiday break. While the situation on campus hasn't changed significantly over the quarter, the exponential growth in COVID-19 cases in the San Diego community and nationwide has resulted in a lot of stress for both faculty and students. Senate guidelines for final exams issued in spring last academic year are more relevant than ever, and I encourage you to go and look up that document on the Senate COVID-19 web pages. Although the Senate, for many good reasons, normalized the pass-no-pass policy for this fall, we really wanted to address the stress and pressure building on our students. And so we've streamlined the petition process for retroactive change of grading option. This has been well received by the students, and as implemented, should not increase the workload on instructors, advisors, or chairs. There's a lot of talk of vaccines, and you'll hear some today. So I ask you to hang in there, have a good holiday, stay safe, and I wish you all the best for the coming year. Thank you. Bob?
Thank you, Dr. Constable. Now we will move into the presentation. So I would like to introduce our first presenter, Dr. Chip Schooley, professor in the Department of Medicine, among other titles. He's going to brief us on the state of the pandemic globally, as well as locally here in San Diego, and the plans for vaccine distribution as they're developing.
Thanks very much, Bob, and very nice to be here today. Even though we're kind of in a bad news, good news situation, I'll start with the bad news. The bad news is something that we're all aware of. The fall surge in cases has arrived in full force across the United States, and we are still going to see things continue to worsen on the basis of the momentum we already have, and perhaps with some additional fuel from the Thanksgiving Day holidays. We're now at a point that we're having about 200,000 cases a day in the US. You can see the trajectory. Things are increasing kind of as we speak, with a total of about 68 million cases so far in the US and over 1.5 million deaths globally, almost 300,000 deaths in the US. Next slide. Here in San Diego, we are also experiencing a surge. This is the San Diego County dashboard, and I'll call your attention to the number 27 up here in the left quarter. This is the number of cases of COVID-19 in San Diego County per 100,000 people, starting over a 7-day period, starting 7 days ago. So this actually reflects something that happened as long as 2 weeks ago and ended 7 days ago. And at that point, we were having 27 cases per 100,000. As recently as about 3 to 4 weeks ago, this number was 7, which was the number that was the trigger for moving us into the current purple tier of restrictions of our activities in San Diego and in the state. The other point that I want to make is that the hospitalizations are increasing rapidly as well in San Diego County. We now have over 930 people in the hospital with COVID-19, and we're seeing an increasing stress on our ICU beds. This has been a problem statewide, and is one of the things that led to the enhanced restrictions put in place by the governor at the beginning of this week. Next slide. San Diego County. Let's now move to UC San Diego. And if you focus mainly on the middle screen, this is the case rate among students. And the main point I want to make here, the dark blue is students living in on-campus housing. The light blue, students living off campus. Before Thanksgiving, we were having a relatively small number of cases, both in our off-campus students and in particular on our on-campus students, with sometimes no cases at all, occasionally a case or two on a given day. With all of these cases being within the students living on campus, being students who had gone away for the weekend or gone out for dinner or a birthday party and done something off campus usually with a breach of protocol. Starting at the Thanksgiving holiday, you can see a burst in both populations that is what we expected to see. And you can see that after the Thanksgiving holidays on campus, you can see these dark blue, we had a surge of cases, which was almost as many cases as we'd had all quarter up until this point in time. You can also see, though, that as the dark bars began to narrow, we think this surge of cases that happened when students went home and picked up or other places over the holidays, picked up the virus off campus. We think these imported cases are now declining. And again, our on-campus rate will decline to not too far from where we were earlier in the quarter. Our off-campus students, unfortunately, are living in San Diego County and still are having case rates that are not that different from the overall case rate of their own age demographic. In fact, a bit better, but certainly reflect the fact that being on campus is safer than being off campus in terms of COVID transmission. Next. Now let's turn to the good news. The good news is on the vaccine front, things are moving very rapidly in the right direction. The FDA's Vaccine and Related Biological Products Advisory Committee, VRBPAC, will meet tomorrow to review the data from the Pfizer vaccine. This is an mRNA vaccine, messenger RNA vaccine, that has to be given as 2 injections 3 weeks apart. This vaccine has had about a 95% efficacy that extends across all demographics. In other words, not just young people, but older people and people with underlying conditions. And in addition, of all of the very few people who got COVID despite being vaccinated, only one of those cases was someone who had moderately severe disease. So it protects both against disease at all and also extremely well against severe disease. The data from this trial will be reviewed tomorrow at the FDA, as I said, and we expect, likely based on the FDA's pronouncement yesterday and the data pack that was put online, that an expedited use authorization will be provided by the FDA, which will allow the vaccine to be given around the country in high priority groups as it becomes available. We'll talk a little bit about the tempo of that in just a minute. The Moderna vaccine is very similar. It's also a messenger RNA vaccine, similar levels of efficacy. Their data will be presented to the same committee next Thursday. Assuming the data look as we expect they will likely look, I would expect a similar response from the FDA committee about it getting an EUA. Next. Now, there are 2 oversight committees or groups from the perspective of the federal government. I've talked so far about the FDA group, and this is the group that decides whether drugs and vaccines and other medical products are safe and effective. And these are committees that will opine about these and other vaccines. The CDC has a committee, the Advisory Committee on Immunization Practices, or ACIP. Its role is for products that the FDA has approved, in the case of vaccines, to provide a perspective on which groups should receive the vaccine, what the schedule should be, and if there's a shortage of vaccines, what the priority should be. And they met over the course of the last 10 days a couple of times to grapple with the issue of these upcoming COVID vaccines. Next. In their recommendations were that the vaccine should be prioritized to people who are either at increased risk of getting infection and getting infected, or at increased risk of getting sick if they do get infected. And what this translates into are healthcare workers and our vulnerable populations. We have coming to us over the course of the next several months about 100 million doses of the Pfizer vaccine and about 100 million doses of the Moderna vaccine, which correlates into being able to vaccinate in toto 100 million people because each vaccine requires 2 doses. And you can see that we have about 20 million frontline healthcare personnel. We also have about 100 million people with medical conditions that place them at higher risk. And we have 87 million essential workers. These are also people who are being prioritized, people who are on the front lines, critical to keeping food supplies going, police, fire, first responders, utilities infrastructure. So we have right now too many people waiting in line for the vaccine doses coming over the course of the next month or two. We also have, though, 3 other vaccines that are on the short list of getting to the FDA. And as these are approved, it's very likely that we'll see these schedules accelerate. Next. Here at UC San Diego, Dr. Shira Abeles has been leading a committee that has looked at the healthcare workforce and made an initial prioritization that is subject to modification based on people most likely to be exposed that who should be vaccinated and offered vaccination in the first line. And you can see that these are people who are most likely to come in contact with the virus, people working in the emergency room, trauma, at times when things may be chaotic and people might not be masked, patients may not be masked, respiratory therapists, intensive care units, and so forth, all the way down through the healthcare workforce. This will be adjusted as more input is provided by people in our community, but it's a very good first start at this. A similar prioritization is going to be put together on campus with a committee that Dr. Khosla is going to be establishing with input from both people from health so that we have some harmonization and people from the campus. And the final slide. I've already alluded to the fact that the vaccines are coming, additional vaccines are coming. AstraZeneca's vaccine may get to the FDA in January. It's a vaccine that the US has bought 300 million doses of and will substantially increase supply once it becomes available and will accelerate access to the high priority populations. Johnson & Johnson has a vaccine that is not too far behind and has the advantage of only requiring a single vaccination, and not far beyond that is Novavax that has a protein-based vaccine. So as these come along, assuming their efficacy and safety profiles are similar, I think we'll have many more options in the early, in the late winter and early spring. As this becomes clear, and as we learn more about what the production rates really are going to turn out to be as they try to ramp up, we'll have a much better set of eyes on what we can expect for our staff, faculty, and students, which will help us plan for later in the spring and certainly for next fall. So I'll stop here and pass it back. Bob.
Thank you, Dr. Schooley, for the sobering update on the progress of the pandemic, as well as the positive news on the vaccines. I would now like to introduce Dr. Natasha Martin, Associate Professor of Medicine. Natasha will present other aspects of our efforts to control the pandemic here at UC San Diego. Natasha.
Thanks, Bob. So you've already seen a bit of this from Dr. Schooley, so I won't go into it in detail, but just to remind you that one of the things we do is every day we meet as the COVID monitoring team, and we review the data in terms of the COVID situation on campus, looking both among our students as well as our campus employees. And there were, much of this information is shown on our public dashboard. This is some information that I've pulled, shown here that you can find on our daily public dashboard. forward. And one of the two additional points that I wanted to say is that, as Dr. Schooley mentioned, we have seen an uptick in cases among both our students as well as our employees post this Thanksgiving holiday. And that was something that we did anticipate. And so you can see in the top left here, the top left bars show you the amount of testing we're doing. And we have been able to increase the volume of testing that we've been performing between 13 and 1,500 tests performed a day among students, as well as 300 to 400 tests per day among campus employees. And then we've also been able to expand the type of testing that is available. Now we have self-administered unobserved testing that we're expanding across campus. So really increasing the ease of testing and testing access. And one of the other things that we developed, we expanded partially in anticipation of this uptick in viral activity, is our wastewater monitoring program. So if you'll go to the next slide, I'll tell you a little bit more about that. So the wastewater monitoring is part of our viral detection pillar. Remember, we have our 3 pillars of return to learn: risk mitigation, viral detection, and public health intervention. And our viral detection pillar is comprised of both our asymptomatic and symptomatic testing, but also our wastewater monitoring. And the idea is that monitoring wastewater could give us an early signal that there is somebody that is infected in an associated residence, and augment our individual asymptomatic testing program. So in that sense, it's a form of pooled daily testing, where we get a pooled wastewater sample from a building or a group of buildings, and we process those samples daily, and allows us to potentially detect infections early and therefore prevent further transmission from those individuals. So as Chancellor Khosla mentioned, we started the term with 6 wastewater monitor samplers. And just during the week of Thanksgiving, just prior to Thanksgiving on the 22nd, we expanded that to 52 samplers on campus, shown here on the bottom right-hand figure. And those 52 samplers cover over 100 buildings on campus. And our plan is that we're going to expand that coverage to 200 samplers by winter quarter. That will pretty much give us full coverage in terms of our residential and non-residential buildings on campus. As I mentioned, the sampling is done daily, and so the samplers automatically collect a sample from the wastewater stream every hour to produce daily 24-hour composite samples, which we then process in the lab. Next slide. So what happens when we receive a positive signal, and how do we interpret it? Well, a positive wastewater signal indicates that there may be one or more individuals that are shedding virus in the buildings associated with that wastewater sampler. So the thing that makes this complicated is that there can be multiple buildings associated with a single wastewater sampler. So on the right-hand side, the black boxes are places where we have placed wastewater samplers in manholes. And you can see in the top left that, for example, that one sampler in Marshall Upper Apartments collects wastewater from a number of buildings in that area, and then feeds downstream, collecting further buildings into further downstream samplers. So what we do as a team is that every day the COVID monitoring team assess the signals across all of our samplers, determines what buildings are relevant for the notifications depending on the patterns of positivity and negativity that we see in the samplers, and then recommends that individuals who are living or working in affected buildings seek testing if there is a positive signal associated with that building. Next slide. And we're definitely learning. We've only recently had this big expansion on campus. One of the things that we have learned is that the wastewater testing appears to be highly sensitive. It appears to be able to detect even just 1 or 2 infected individuals in an associated building. And therefore, it could potentially augment, as I mentioned, this weekly testing to provide additional protection against transmission. We have had several cases where we have seen positive wastewater signals. We have then put out a subsequent notification to the affected building residences. And over the course of Thanksgiving week, for example, we subsequently diagnosed 4 individuals across 4 different buildings who were asymptomatically infected, and subsequently went for testing because of our notifications. there is still a lot that we are learning and many open questions. We're still learning about how to interpret these signals. We see sometimes two wastewater samplers that are positive, one that's upstream and one that's downstream. And it may be just that downstream signal is picking up that upstream positivity. We're still learning how to interpret that. Additionally, we know that in some cases, individuals who have resolved their infection may still shed into the wastewater for a period of time after their resolved infection. So we're still trying to understand how that might be affecting the signals that we see. And one of our main things that we're thinking about is how to improve the notification process from our wastewater positive samples. So we have seen that we do see a bump, an increase in testing after we put out notifications, but that the response is much better when we tailor our messaging really to the individuals in those affected buildings. So we're developing strategies like listserv strategies so that we could send focused emails or perhaps text messages to those affected residents, paper notices in buildings so that people can see it there, as well as providing this information on the daily dashboard and potentially the UCSD mobile app to really get this information out as widely as possible, but also as specifically as possible to the potentially affected individuals. And with that, I'll hand it back over. Thank you.
Thank you, Dr. Martin, for the updates. I would now like to introduce Vice Chancellor for Research, Sandy Brown, with an update on the impact of the regional stay-at-home order on our research activities. Sandy.
Thank you, Bob, and good afternoon, everyone. Pleased to be with you today. We are so pleased that as an essential part of the university's mission, research is able to continue even in the midst of this stay-at-home order by the governor. But by way of reminder, those who can work at home, conduct the research at home, their portion should continue to do so. And through the weekly meetings that we have with the Research Continuity Task Force that's comprised of faculty, staff, students, and administrators, we've identified several issues that I wanted to bring to your attention today. One in particular is that we need to be sure that we are being sensitive to concerns that might be raised by the staff in the research settings, any discomfort they might have, particularly in the context of the rise of the prevalence of COVID-19 in our community, but also concerns for safety that any research participants might be reporting. And so we're urging faculty and staff to have these discussions, and for those who are uncomfortable being on campus, that they work with their lead investigator to determine what kinds of work can be done at home. I want to remind people that during this hold in place period, we will not be approving new activities, but currently approved plans in the research ramp-up system will be able to continue. If a researcher needs to make some changes in personnel, you can do trades as long as we're staying within that 25% cap. We have over 6,000 individuals on our campus every week who are conducting research. Over 450 of them are undergraduates, over 1,100 are graduate students, and they're operating wonderfully to our knowledge. We have no evidence of any transmission in the research setting on campus. The final thing I'd like to mention is that students who wish to continue, of course, can continue in these research activities that advance their educational mission. If they're working on a master's thesis or a dissertation, or they have a class or a training rotation that requires this research experience. But no student should be pressured or coerced into coming on campus to do research. And on the Research Ramp Up website, we have the numbers and email addresses if there's any confusion or there's a need for any discussion of that. The faculty who oversee the research programs are expected to ensure compliance in their setting so that it can be a safe and healthy place for everyone who comes onto campus to do research. So everybody knows about our daily screening and the testing expectations and the behavioral health safety activities and quarantine requirements. Those are all in place. And we really want to encourage you to utilize the Cal Notify app that will make exposure identification easier for you and have testing more rapidly available to you. Bob, with that, I think I'll close. Thank you.
Thank you, Vice Chancellor Brown, for that update. I would now like to introduce Himlata Javeri, Executive Director of Housing, Dining, and Hospitality. Himlata will share updates with us on the plans for winter housing for students. Himlata.
So in light of the recent positive cases that we just heard from our experts in San Diego and across the country, on-campus housing will continue to remain at single occupancy for winter quarter. This is for undergraduate students and graduate students. Our graduate students have always had single occupancy. So this exception really applies to our undergraduate students. All decisions that are made in housing and dining are led by consideration of health and safety of our students, employees, and the local community. As we also heard, the campus will be increasing asymptomatic testing. Students that live on campus currently are required to test twice a month, and this will now move to weekly testing once we start the winter quarter. We also heard about the increased scale of wastewater monitoring. Again, that will increase the frequency and the number of monitoring stations on campus. Our on-campus dining will continue to be offered in a to-go model through the Triton to-go app, which our students have been using robustly. Depending on the dining facility, we're seeing 70 to 90% of the orders being administered through the Triton to-go app versus in person. Indoor dining will continue to remain closed. Indoor dining was not open for the entire fall quarter. And again, we will keep indoor dining closed. All students so far that have applied for winter quarter housing, we have about 1,000 on the wait list, will be offered housing contract. We have enough single rooms that we do not have to turn any undergraduate or graduate student away. All room assignments will be available to students in mid-December. Of course, the next most asked questions we'll get from students is in terms of spring quarter 2021, and the wait list will open in late February 21 after we've consulted with the health experts. And with that, I will turn it back to Bob.
Thank you, Himlata. Next, we're going to hear from Vice Chancellor Allison Satterland for Student Affairs. She's going to talk about how we're dealing with the student experience during the pandemic and resources to support our efforts. Allison.
Thank you so much, Bob, and really a pleasure to be here and share some of these resources. So our role is to support the health and well-being and engagement of our students, and we have, thanks to the partnership of many here with us today and our frontline and essential team members, both in the colleges and across the graduate division, have been working diligently to keep our students healthier and supported. So a few examples I wanted to offer is we have developed a virtual student union where students can find in one location a number of programs that have been showcased in fall 2020, as well as opportunities that we hope students will join us for in the coming winter 2021 quarter. Our student health and well-being programs and services through UC San Diego Health Student Health and Wellbeing Cluster are available 365, multiple hours a day, 7 days a week, and providing telemedicine, support groups, recovery services, peer education, a number of programs to enhance students' health and well-being, meditation, growth, again, working directly with a psychologist or MFT. We have a great program that's been created by our recreation and outdoor leadership program, The Playground, which provides a plethora of virtual health and well-being resources through Zoom and pre-recorded YouTube options, as well as outdoor activities for students to partake in a self-guided manner, particularly given the recent state guidelines around stay at home. Career Services has also made available a number of remote services for our students through Zoom counseling with a career services advisor. They've provided some self-guided information for students to develop LinkedIn profiles and resumes, and to use the challenge of the pandemic to perfect their elevator speech and interests in preparing for interviews and post-university success. I'm also really happy to share that our undergraduate research experiences, a number of them in partnership with VC Brown, hosted through Student Retention and Success, have been moved into a remote environment. And our AEP program, which is a hub for undergraduate research, has had more participation than ever in its undergraduate research experiences. And we've heard positively that that's because these are now accessible remotely for students who would not have been able to access them prior, and to be mentored by faculty on campus and across the world as well. Something a bit of a silver lining in this remote environment. We've also been creative in working to create self-guided campus scavenger hunts and outdoor exercise recommendations, something that we know that our students will need to have on hand through their phones or the UC San Diego app, really trying to utilize technology to help move our students through this difficult time. As we move into winter break and winter quarter 2021, and certainly this spring, we've been encouraging our students through programming and education to really think about hope and affirming growth mindset, that our students can learn and adapt in this difficult environment, but acknowledging that the challenge is real, and encouraging self-compassion and support for one another. We'll be hosting our Winter Wellness 2021 Symposium in the winter quarter, and this will be the theme of that particular effort. We're also, as you've noted from the research and data that's been presented prior, really proud that our campus at this point continues to remain a safer place for our students, and by providing on-campus housing, we're able to ensure our students have access to testing and health and well-being resources. And we're also proud of the work that happens through our basic needs program and the allocation program that continues to be available through students in our partnership with HDH and our college deans of student affairs and our graduate deans of student affairs as well. But thank you for the opportunity to quickly overview those services. I'm happy to take questions later as well.
Yeah, thank you, Vice Chancellor Satterlin, for that update. Finally, we're going to hear from Associate Vice Chancellor for Education Innovation, Carlos Jensen. He's going to tell us about the status of winter enrollment and our outdoor teaching tents that are now on campus. Carlos.
Thank you, Bob. So it's my pleasure to share an update on where we are in terms of winter classes and winter registration. As you can see here, winter is currently looking very much like fall term. We have about 7% of undergraduate sections currently planned to be offered in person. These are numbers from this Monday. And we have about 12% of graduate and 16% of undergraduate students that are registered for one or more in-person course. Now, that also includes research activities. And there's a number of students that are doing research activities only and all their coursework remotely. We are still in the process of shifting courses into the outdoor classrooms. The deadline for that is coming up shortly, and I'll speak about that in a minute. And as EVC Simmons explained, there's still some uncertainty about what situation we will be in when we come back in January, what restrictions we'll be under. The state order does allow us to continue to do outdoor teaching. Next. So for those of you who haven't had a chance to go out to Warren or Evel to see our outdoor tents, our outdoor classrooms, they are really fantastic. And we've had a number of faculty now who have used them. We had about 22 sections shift to outdoor teaching over the last couple of weeks. Right now we have 4 fully equipped classrooms ready to go. The same kind of amenities that you would expect in an indoor classroom, but with about 10 times the air movement that we see in an indoor room. And as we think about safety, it's the accumulation of the particles suspended in the air that is the largest risk factor, even when wearing masks, and the outdoor setting lowers that accumulation dramatically. Right now, we're scheduling classes from 8 a.m. to 8 p.m. The tents are fully lit, they're fully serviced. They're very flexible. So we have a number of faculty who are doing regular lecture type of instruction. We have some faculty who are hosting seminars with remote speakers zooming in. And then, as you can see in the picture here, we have some faculty who are turning the tent into race courses for their students to do their final projects and have some fun. So as I mentioned, the first priority for shifting classes to the outdoor classrooms is coming up tomorrow on December 10th. Those faculty will be given the highest priority, and then after that, it will be first come, first serve. Next. At the same time, we're working to improve and to continue to support faculty doing remote teaching. We expect to see the same kind of limitations when it comes to occupancy and density of the building. So we have set up remote teaching labs and remote teaching classrooms. We're going to continue to work to make those as engaging and as fully featured as possible. So some of them will, when we come back in January, actually have the light boards. So you'll be able to write and see your students at the same time and have a more natural interaction with your students through the lecture. Just a brief reminder that you have a lot of flexibility in remote teaching. Lectures can be pre-recorded. You can use a flipped classroom setting and spend your time in interaction with students instead. And the Teaching and Learning Commons and ETS are always ready and willing to help navigate or train or help you transform your curriculum to fit that medium. As EVC Simmons briefly mentioned in her remarks, there's a possibility that we will still be restricted to outdoor instruction only when we start in the winter, and we're working on contingency plans and options should we have to do that. So back to you, Bob.
Well, thank you, Carlos, and thanks to all of our presenters today for bringing us up to date on what's going on our campus right now with respect to the pandemic. Now is the time to move on to the question and answer segment. I invite all of our panelists, also including Dean John Moore, Dean Jim Anthony, Vice Chancellor Gary Matthews, and Dr. Angela Sosha to turn on their video at this time and join for this second part. During registration, attendees had an opportunity to submit questions for the panelists to answer. We've selected some of the most popular questions for the panel today. And of course, as many have been doing, if you have a question now, please use the Q&A window to submit additional questions during this session, and we'll do our best to provide the answers either now or due to the time limitation afterwards at our FAQ on the returntolearn.ucsd.edu website. So let's get started then with the first question is for EVC Simmons. So EVC Simmons, the Office of the President recently proposed curtailment days for reducing activity and saving dollars on the campus. And the question is, will UCSD participate in these proposed additional curtailment days?
I'm very glad that you have asked this question, because I'm happy to be able to say, no, we will not need to do that. I'm going to put into the chat a link to the notice that the Chancellor sent to campus about this. It was sent right before the fall break, and I'm sure that people were probably busy with other things and not just reading every email that came their way. But basically, what OP said was that each campus needed to make sure that it had restructured its finances sufficiently to not let go any employees purely for pandemic-related financial reasons. And that's the cutback that everybody needs to make. They suggested curtailment as one way a campus could do that. But as I think people will remember, last summer we went through extensive budget planning exercises on our campus and achieved by October 1st the budget reductions that are already sufficient to take care of what OP is talking about at this point. So as the Chancellor said in his notice, we don't need to do any further curtailment. We are set for this current year, the 2021 year. And I'll put this, the specific link in 1 second.
Well, thank you, EVC Simmons, for that good news. Our next question is a live question from the Q&A for Vice Chancellor Brown, and it regards in-person human subjects research. In particular, will testing be available for human subject participants in that research?
Well, testing is not available for all human subjects research, but some protocols require it. And in that case, the cost will be covered. What is required for all human subjects research is symptom screening in advance. Normally what's expected is a report for any symptoms in the prior 2 weeks, and then a reporting on the day of participation in research. So we do recommend that all individuals who are going to come to participate in research receive information in advance about all of the safety precautions that we take on our campus and in the particular study that they're participating in, and have an opportunity to discuss any concerns that they have so that they can feel safe and comfortable coming into campus.
Thank you, Vice Chancellor Brown. The next question is for Dr. Martin, and it pertains to wastewater testing. It's obviously a huge effort to do all this wastewater testing, and the question is, can you explain in a little more detail the importance of the wastewater testing to our response, briefly?
Sure. So the wastewater testing is an additional way for us to stay one step ahead of the virus and viral activity on campus. And as I mentioned before, it's meant to augment our asymptomatic testing program. So we can, an individual may test negative on Monday, but then may develop infection on Tuesday and not be tested for another week. With our wastewater testing, we'll be monitoring all of the wastewater from that residence. If we pick up a wastewater positive signal on that Tuesday, we can send an alert and have those individuals tested on Wednesday and then detected. So again, it's really a way for us to stay one step ahead of this and try to use an additional kind of technology to detect outbreaks early and detect infections early and prevent the risk of transmission on campus.
Thank you, Dr. Martin. The next question is for Dr. Himlata Javeri and Dr. Sosha. Will you allow more students to move on campus in winter quarter 2021? And how is that student move-in process going to work?
Thank you, Bob. As I shared earlier, we have about 1,000 students on the undergraduate side who would like to stay on campus for winter quarter, and we have ample capacity in terms of single rooms for them. So yes, we will allow additional capacity on campus. Move-in will be staggered, but in a shorter manner versus what we had for fall quarter, given that our new student population is going to be really small. We were working very closely with Dr. Sosha and her team on the testing piece. So for new students, they will go through a similar model of a drive-through testing. And for students that are returning from campus or returning to campus, they currently live on campus. Right now, they're going through a self-administered process of testing, and they will be able to take advantage of the self-administered testing in their residential location. And with that, I'll see if Dr. Sosha would like to add any additional details.
I think that was a great summary, Himlata.
All right, thank you to the both of you. The next question is for Dean Moore, Dean Anthony, and ABC Jensen, and it's about the the potential for in-person classes in winter quarter 2021. So will there be any in-person classes, and are we researching and exploring innovative and safe ways to return to in-person classes?
Well, I'll be happy to take that. Yes, we are expecting to have in-person classes in winter term. Ultimately, it's a faculty decision how you choose to teach and what the right option is for you. Our job is to try to create as many opportunities, as safe opportunities as we can. So I already mentioned the outdoor classrooms. We also have a group of faculty that are aggressively researching more proactive use of the HVAC systems in the existing buildings and classrooms to increase safety. Not that we've seen any high-risk activity associated with any classrooms, but we are constantly looking for ways that we can make the activity that we have safer.
Thank you, Carlos. In a related question, I'm going to direct it to you again in regards to the possibility of teaching remotely, but having the exams held in person on campus.
That's going to be very, very difficult. And the reason is students are making housing decisions based on whether they take all remote or some mix of remote and in-person classes. And so think of the logistics of having students spread across the country or across the world, or even just across the state, and requiring them to fly in, drive in to take an in-person exam. The logistics of that would just be impossible.
Thank you. And while I have your attention, Carlos, I have one last question. What options will be available to faculty who want to teach hybrid laboratory courses for the winter quarter 2021?
I feel like you're picking on me. As I said in the previous answer, we are working with faculty where we can. So we're having some conversations about some dry lab type of courses, whether those can be done outside. At the end of this term, we had some faculty who in engineering who did move some of their activities to both the outdoor classrooms as well as pavilions and terraces that we have available. And anything that we can do, please reach out to the Educational Continuity Task Force and we'll see what we can do.
Thank you, Carlos. The next question is also instruction related, and it's for Senate Chair Constable and Dean Moore. Why not allow all courses to be taken as pass, no pass?
Yeah, I'll start that. The Educational Policy Committee considered this really quite seriously over the summer to try and work out what to do in the fall quarter. They chose not to extend the exemptions to policy on pass, no pass for a number of reasons. First one was students by the fall quarter were thought to have got a better understanding of what the remote instruction looked like. And so the uncertainty that we faced in the spring quarter should have dissipated by then. And there are a lot of unintended consequences to having too liberal a pass, no pass policy. Students could put their financial aid at risk. They could end up not taking enough courses that counted towards their major. They could damage their GPA in a way that would compromise their ability into graduate school. And so we thought on balance, it was best to revert to the standard policy and also do it in a way that was early and predictable so that there were no surprises. Now, we also considered that things could very well be getting worse in the fall and winter. It has, as I mentioned in my introductory remarks, put a lot of stress on the faculty and students. And so we have implemented a provision for a retroactive change of grading option as a way to give students who feel that they have been compromised by the current circumstances in order to take accommodations. But on balance, we will be looking at the policy for winter and spring, and we will be doing that as early as we can, so that if we do decide to change policy again, the students will know about it well in time to make sensible decisions. John, would you like to add anything to that?
Just I'd that the policy on pass, no pass is fairly distributed. So there's a Senate policy that determines when a student can change a grading option. And then there's also a Senate policy which is system-wide, that limits the number of pass, no passes that a student can have during their academic career. But many departments and majors and general education requirements have specific letter grade requirements. So a change in the Senate policy would not necessarily change that, because those are requirements that are department specific and are vetted by the Senate through the normal vetting process of departmental requirements. So while students can change their grading option retroactively for fall 2020 to a pass, no pass, we are also letting the students know that they should be checking with their departments whether these pass grades could count towards their major requirements. Departments will have the option of waiving their letter grade requirements if they choose to do so, but this is a department by department decision. And as Chair Constable mentioned earlier, we're trying to do this in a way that will have the least burden on the departments in terms of administrating this.
Thank you. So the next question is for Dr. Schooley, and it pertains to the exposure notification app that I'm advertising with my backdrop here on this Zoom call. And the question is, how has the exposure notification app performed to date?
This is something Chris Longhurst has been both intellectually and operationally one of the leaders in the whole state about. UC San Diego was the kickoff campus to do this, and we now have got about 15,000 people in our community who have activated this on their app. We've had already over 50 instances of people who found they were infected, had the app activated, and then sent an activation code out to the people who they might have been in contact with. Now, because of the way this is set up, so it's confidential, they don't know who they might be notifying. Their phone just says to people with whom they've exchanged tokens, you may have been exposed to COVID-19, you should go get tested. So from the operational perspective, I think very well. And it's very likely that some of these are people who didn't realize they were infected. We don't know because of the confidentiality aspects of it. We've had no issues at all of concerns raised by people who have been using it about breaches of confidentiality or any major concern. So I would encourage people to do as I've done and activate it. And that way, if you are unlucky enough to get infected, you can at least notify people who've been in your proximity and let them know they should get tested too.
Thank you, Dr. Schooley. The next question is for Vice Chancellor Satterlund. As we think about our campus community, some people are wondering if anything is being done to support campus businesses like the coffee carts, restaurants, bookstore, the Sunshine Store.
Thank you, Bob. This is a thoughtful question. So most certainly for the last several months, we have been working with our campus vendors to provide rent relief and also to ensure that opportunities for pop-ups and delivery services are available for folks on our campus who'd like to take advantage of curbside pickup and such. Are available. In addition, we have had, of course, to follow the state and local guidelines, and it's not just our campus vendors who are challenged in this particular time. So I appreciate the question and know that when it's time to get back on campus, our vendors will be very, very happy to see you.
Thank you, Vice Chancellor Satterlund. So the next question is back to ABC Jensen. Remote students do not take courses that are listed with a room on campus. Can it be clarified that hybrid courses are available to all?
So this has been a challenge since the beginning. Our catalog system was not designed for the concept of hybrid, and it's a new concept to our students as well. We don't have a way of indicating that a class is a hybrid class. Right now, the best solution that we have is for departments to put in a note in the course comment section, and we're actively working with both the registrar and the advising community to clarify this question, and we're hoping that for this next term there'll be fewer bumps along the way.
Thank you. Thank you, Carlos. The next question is for Vice Chancellor Matthews. And the question is, how can I find more information about safety and cleaning issues associated with campus facilities?
Thank you, Bob. It's a great question. There are a number of options. One, our websites through resource management and planning, our specific departments, environmental health and safety, as well as facilities management, all have information in terms of what the cleaning opportunities are, and most importantly, what the schedules are. I would also say that for facilities management, as an example, they operate a service desk. So if someone has a specific concern or problem, question, they can certainly reach out to that service desk. Another option, quite candidly, is if you've got a specific concern that you've asked or gone to the website and couldn't find, you can always reach out directly to me and we'll make sure that you get a response.
Thank you, Vice Chancellor Matthews. I would just note it's 4 o'clock now, but we are going to go over by a few minutes to ensure that we can answer as many questions as possible. And the next question is for Dr. Schooley, and that concerns antigen testing. And is antigen testing available through UC San Diego?
We have a handful of antigen testing kits in the Comm Lab. Dr. Pride has been looking at them carefully to better understand their operating characteristics. And to make a long story short, the ones that we have available to us are substantially less sensitive in his hands than nucleic acid testing. In a discussion with him in anticipation of this question this morning, a study he did suggested that the sensitivity of these compared to nucleic acid testing is only 45 to 50%. And is best in people who are most recently infected. So we aren't using them, for example, to diagnose people who may have acute infection. People have argued they may be very useful for doing screening because the people with highest viral loads are the ones most likely to be contagious to others, but this hasn't been rolled out on a large scale anywhere yet. And right now our nucleic acid testing is working very well. There is not right now an order availability to use the antigen test in the traditional hospital system, like serum sodium, for example. But as the tests get better, we hope they'll find a place next to nucleic acid testing, but they're just not there yet.
Thank you. Thank you, Chip. The next question is for Vice Chancellor Satterland. So how in this period are we helping students socialize? It's such an important aspect of the college experience, and this year we're missing out on that.
So another thoughtful question, and it definitely is not normal or usual in any way. So until the recent stay-at-home order, we did have permission from the county for a pilot that we called Three's Company, where students could socialize outdoors, masked, physically distanced with 2 other students doing the same. But with the recent surge in COVID-19, we've had to restrict that pilot. We've really invited our students to put themselves out there for remote and virtual experiences. And I'll just share one anecdote where we've seen quite a bit of community emerge. So our university events office, which puts on a large scale events, has shifted to experiment with different venues and different modalities in the remote and virtual world, and have found that students are responding to smaller settings around unique experiences, such as a magician or a YouTube influencer, and they're building community in the chat the same way that we all do during our meetings. So we're just encouraging our students to take advantage of those, to put themselves out there in that realm until we can come back together and take the best of the remote experience alongside being in person and getting back to being in community in the ways that young students and humans need to be able to do regularly.
Thank you, Vice Chancellor Satterland. The next question is for Dean Moore and Dean Antony, and it's concerning academic integrity. So what campus level support has been developed to help support academic integrity efforts here during the pandemic?
I can start on that. So the Keep Teaching website has many has things for faculty to look at, resources. We know that particularly the assessment during the remote environment is particularly challenging for promoting academic integrity. So the Keep Teaching website has a number of ways to structure assessments in order to promote academic integrity. So a lot of this has to do with how the assessments are structured. And so that's Keep Teaching. You can also go to undergrad.ucsd.edu and then look under units and go to the Academic Integrity Office that also has discussion about how to promote academic integrity. We had an uptick in cases in spring quarter. So far, however, in fall quarter, the number of cases seems to be pretty much what we normally have. So that may be leveling off.
The only thing I would add to that is that we as faculty should always be aware of any kind of demands that our decisions about academic integrity will make on teaching assistants who we collaborate with as we're working in the classroom. So just keep them in the loop on your decision making, and obviously the teaching assistants themselves will probably be many of the front lines, if you will, in terms of finding students who are having challenges with academic integrity. So it's good to be in conversation with your TAs.
Thank you. Yes, very important to keep in mind our graduate student TAs. There's one more question we're going to be able to address today, and this comes from the live Q&A, and this is for Vice Chancellor Brown. And so at this time, can undergraduates who will be enrolling in winter quarter 199 courses for undergraduate research be added to a lab's research ramp-up plan?
Oh, great question. You know, just as we want to encourage our students to engage in new kinds of activities, social activities in different formats, we encourage students to sign up, to work with a faculty member and to sign up for a 199. There are ways to do that, some of which involve work that is done on campus, but sometimes it's not done on campus, and you need to work with the individual faculty member to be able to do that. Many faculty can adjust schedules in a way that allows students to be in the research setting on campus during periods of time that still allow them to sustain that 25% cap at any time. So the answer is yes.
All right, well, that's good news, because that's such an important part about research, a research university, the experience for the students. I guess I would have one more question to Chip Schooley. Can you say something brief about the vaccine safety issue? Because a lot of people are concerned about it. There was some news today out of Britain about people with allergies and so forth. Any brief comments in that regard?
So far, the mRNA vaccines appear to be remarkably safe. They do cause some irritation at the site of the injection. People, about 5% of people may have a temperature of as high as 102 or so, about 24 hours, that responds pretty well to Tylenol and goes away. In the over 30,000 people in the first trial, there were only 2 deaths in the arm that got the vaccine, and these were both people. One of them was a person who died of a heart attack 2 months after the last injection. The other one was somebody who died of cardiovascular disease. This is a group of people at high risk. There were 4 deaths in the placebo group. So the point to make here is that we're going to see things happen in vaccine trials just like they do in the rest of us every day. The reports coming from the UK are 2 cases of people who had an anaphylactoid response. This has just appeared since this morning on some of the in the lay press. The Medicines Research Council of the UK has noticed that these 2 people were people who happened to be carrying EpiPens and were prone to allergies anyway, and are suggesting that people who carry EpiPens for now not be vaccinated or be vaccinated in places where they could be resuscitated. Whether this is causally related to the vaccine itself or not, we don't know. We do know people have vaccine allergies and responses to things they get injected with, and we'll have to follow it closely. But that noise is new to the system and occurred just since this morning. I think we'll hear a lot more about it tomorrow at the FDA Advisory Committee hearing, if there's concern about it.
All right, well, thank you for that important insight into the vaccine prospects. Well, I'm afraid that is all the time we have for today, but I want to thank everybody for the questions. We're going to be working to answer all the questions that were submitted by updating the FAQ on the your Return to Learn webpage, and also posting a recording of this town hall for later viewing. please complete the post-event survey as well. That'll be sent to you shortly, and that helps us work on this very important mode of communication during these remote times. Today, this concludes our faculty town hall for today. The next town hall is one for staff that will be held on December 15th at 4 p.m. So I'd like to thank the presenters and the guests today for sharing their time and information with us. And I would really like to thank you, the faculty of UC San Diego, for attending today, working together as a community to help bring us through these unprecedented times. Thank you. Stay safe.